And I was like, sleep medicine, who wants to do that? And it turned out it was me.
This is Shadow Me Next with Dr. Benjamin Long. Dr. Long, thank you so much for joining me on Shadow Me Next today. I've already told you how convicting for me this conversation is going to be, how much we are going to learn about something that everybody always complains about and almost wears as a badge of honor, but yet is not interested in really working to fix it. And we're going to highlight why they need to be interested in that today. So thanks for being here.
I'm so excited to be here. Thank you for having me on.
I am very excited that you're here with me today. So let's talk a little bit about your background. You are a dual board certified sleep medicine physician and pediatrician. For those listening, tell us what this means. What does it mean to be dual board certified?
Yeah, when you think about specializing in medicine, most of the time it's pretty straightforward with like, I'm a do the pediatrics residency, and then I go and jump in to do pediatric gastroenterology. But the reason I use the language dual board certified is because even though my niche is pediatric sleep, I'm board certified through a partnership between the American Board of Pediatrics and the American Board of Internal Medicine to see all ages of sleep. So it's this really interesting thing. The most prominently, you can get it in sleep medicine, and allergy is another similar place where you can come from a different residency core specialty to be able to really, in a way, practice a totally different field of medicine. And instead of like, in my view, where so many specialties kind of narrow down to your not just kids, but kids who have stomach or heart problems, it's like I was able to kind of go through a door and almost enter a totally new world where I could see all ages for sleep medicine.
So thank you so much for describing that. So it's so interesting because I think this is one of those questions that pre-health students have a lot, right? Is Ashley, I'm really worried that if I go to medical school and I become a doctor, I'm going to be pigeonholed into one specialty for the rest of my life. And I'm 21 years old and I can't plan the rest of my life right now. I don't know what I am going to have for dinner, let alone what I want to practice for the next 4 decades. But what you've described really is some flexibility there, which is actually really nice. And the question I have for you is almost a chicken or the egg question, which came first. Did you know you wanted to, when you first started thinking about medicine, did you know you wanted to become a pediatrician and then found an interest in sleep medicine, or was it the other way around?
Definitely the first. My grandfather was a pediatrician in Columbus, Georgia
Oh,
for very long time. I even have memories of going up to the hospital with him as like a kid and like sitting at the nurse's station and like kind of doing rounds. I guess this was like pre-HIPAA kind of thing. So that was really formative for me. And anytime I would go anywhere with my grandfather, it was like Dr. Sizemore. We would always run into someone. Kids were like running up to him and stuff like that. So that was like this big thing in my mind. And so I made a decision to be a pediatrician like when I was 12. I feel like a lot of pre-med students, and then once we got into medical school, it was like people like me who were like, I knew from a very young age I wanted to do this. And then I would meet these people who were like, I just decided, yeah, I'll give medicine a try. And I'm like, what? What are you talking about? Like, you mean this hasn't been like your goal for the past like 10 years or half your life kind of a thing? Um, and so I, continued on that trajectory. And really, I got towards the end of my pediatrics residency and I kind of, I was like head down, work, 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 work. And like looked up and I was like, oh, I don't know if this is what I want to do because
Mm.
I almost had a little bit of the rose-colored glasses on because I was like the kind of stories and the what I witnessed with my grandfather and how he practiced that exists, but it's more rare these days. And so some of it definitely was self-preservation, I think.
Mm.
Um, but also I just happen to rotate on sleep. And we often talk about click moments in medicine where you have the undecided student who like, I don't know, and then you rotate on something and it just clicks. That was exactly it for me in sleep. My first patient was the pediatric sleep clinic. And it was a kid who had kind of like a complex medical history that I was familiar with as a pediatrics resident. So the staff sent me in there, and it was just this really different flow of the conversation. And um, the the cool thing about sleep is that it's like whenever you can fix someone's sleep, they're so happy.
Yes.
Like so, and it's so some of it is a little bit of like immediate like feedback too, like by the second or third follow-up, usually people are like, oh yeah, I'm doing so much better, or no, it's still not helping, and then I kind of have to continue down that road. So yeah, I to the point that when I was an intern, I was in like an orientation breakout group that was led by a sleep medicine fellow that year. And I was like, sleep medicine, who wants to do that? And it turned out it was me. So
That was you. Oh, that is such a cool thing. And that's kind of what I expected, was that you enter medicine, and like you said, from 12 years old, you knew this is what you wanted to do. And I do want to talk about your grandfather here in just a minute. You enter medicine, you fall in love with medicine, you all of a sudden see behind the curtain of medicine, and then something catches your eye, is really kind of the visual that I'm hearing now. And I think sometimes it does take a bit of bravery to follow that. Like you said, who wants to do sleep medicine? Oh, wait a second. Well, perhaps that is me. Thank you for describing that. It's a really cool journey. Let's go back and talk about your grandfather for just a second. Because you
yeah.
mentioned something that I think will be really, really helpful to our pre-health students. And that is really the magic of medicine is what you got to see when you were 12 years old, right? And the nurses and the banter with the nurses, and the respect that your grandfather really had earned with his families and the kiddos. And you mentioned what you saw with him does still exist, but it's also changed, right?
Yeah.
Let's give our pre-health students a peek behind the curtain. What are you talking about when you say those things?
Yeah. I think one thing is that there definitely are still opportunities where you can, especially go into like a primary care field and go to a small town, and you are integrated into the fabric of that community in a very real way. There are voices online right now, and there's a little bit of a conversation around, should I consider medicine as a calling, or is this just like a job like any other job?
Mm-hmm.
Um, the funny part about medicine is there's a lot of a whether you want to call it a philosophy worldview, I would argue even a theology of how I go into that we're not trained to understand or talk about really, but that undergirds so much of how we go about doing our job as practitioners.
Mm-hmm.
And um and so for there is I've seen this trend online of more people like, this is just like a job, 9 to 5, like any other thing. And in certain systems where you don't necessarily have that control over your schedule, or um, the autonomy as much to make some of those decisions, then that is a little bit of a self-preservation. And it's kind
Mm-hmm.
of like, okay, I'm going to clock in, clock out, because that's what this system demands of me if I'm going to survive here. But there are other opportunities where you can, control your own schedule. You can um, be integrated into a community and, you know, find connections and fulfillment in a way that is that kind of like older medicine. I do have a story as far as like, so for a long period, I have actually been in the military as a military practitioner.
Wow.
And so the real beautiful thing is when we lived up in Alaska, we lived on base. And so really every single child who was on my street was a part of my clinic.
Wow.
And so I had moms with newborn babies come knock in the middle of the night, and they're like, "Oh my gosh, can you just like, check on my baby?" And I that's very rare. I would offer to all of my neighbors, "Hey, call, like if I can be your kind of checkpoint so that way you're not spending the next 4 hours in your ER,
Mm.
then like, yes, please utilize me in that capacity." And people actually didn't take me up on that offer as much as I thought they would, because most people would be like, oh, I don't want to be a bother kind of a thing.
Yes.
And so, I had newborn babies on my dining room table. I had, went over to a neighbor's house and like diagnosed a pneumonia and stuff like that. And it was so fulfilling because it was like, these are people I know that I love and they're so appreciative. And so it just
Mm,
hits way differently. And I was like, this must have been what medicine used to
mhm.
be like. And I know that is still possible and still exists. It's just, you have to find it.
You do. And you have to fight for it too, I think
Hmm.
sometimes. Um, oh, I kind of have goosebumps thinking about that. It's what I think we all really, really desire just for general care. When we
Hmm.
are in emergent situations or when we are in really significant diagnostic, the throes of a bad diagnosis,
Yeah.
those things become a little bit less important, right? We just need somebody to help us, to fix us, to make us better. When it comes to our care as humans, and you mentioned
Hmm.
theology, and I am very excited to dive into that because it plays a big part in who you are and how you practice. But a whole person care, it does require relationships. In my opinion, it really does. I think
Yeah.
it makes patients feel more heard. And
Hmm.
I think the visits become more cooperative. And
Yep.
ultimately, they end up with a better lifestyle because of their relationship with the person who's helping them with their health. You mentioned how people don't take advantage often when you really open yourself up as a clinician and a person. And I would absolutely agree with that. Especially recently, the number of times I've given my cell phone to patients, with the exact same instructions. Please call me if you have any questions about anything. It's not so much a workaround. It's just, I want you to feel like you have access, and that people are available to you.
Yeah.
They rarely call, ever, hardly ever. If
Hmm.
anything, I get a Merry Christmas text as opposed to a phone call about a health issue,
Yeah.
So it's it is really lovely. And I thank you for describing all of that. I think it's important that students realize that it's not always rainbows and butterflies, but there is still a lot of goodness here in medicine, and you do sometimes have to seek it out, but it's there.
Yeah.
Let's pivot just a bit, because I would really love to hear a little bit about sleep medicine and
Hmm.
what that practice looks like for you. So, describe a day to us where you're focused on taking care of people with disordered sleeping.
Yeah. I've been in a really unique situation for a lot of my military career, and that actually I split my time between my sleep practice and my general pediatrics practice. So I really have done both for my attending career to this point. A typical day in the sleep medicine clinic is, going in. Most people will kind of have half days of or some time kind of in between to actually read sleep studies versus seeing patients in clinic. So those are
Mm-hmm.
kind of the two points there. You've got several different kinds of sleep studies. You have the ones a lot that you see that you can just do at home versus the full get up where have, leads on your head for the EEG, on your eyes, the nasal cannula, chest bands, stuff on your finger and all this stuff. And then we're like, oh, also, by the way, there's a camera over there watching you
Yes.
go to sleep. So super comfortable. And so then we read all of that data for a night and kind of create a report based on that. So that's kind of one side of sleep medicine. I think a lot of practitioners really enjoy that part because there's a little bit more flexibility in that
Mm-hmm.
compared to having the demands of appointments back to back. And then for me, a typical day as my niche is pediatric sleep, is doing a pediatric sleep clinic. And so that's where I'm having patients that sometimes it might be a classic 7-year-old child with, huge tonsils, and mom shows me a video and the kid's like, I'm like, yeah, you need to get a sleep study, kind of a thing. That kind of goes down that direction. A lot of times for pediatrics behavioral. And so I made it a priority in my fellowship and my training to really make sure that I was comfortable with the behavioral sleep problems that occur
Mm-hmm.
in pediatrics. And so that's everything from that we think of like babies who are having difficulty around sleep training. We could have a very long conversation on that because there's so much misinformation out on the internet with that right now. And I couldn't tell you the number of times, I'm not exaggerating, mothers sitting in front of me crying
Mm-hmm.
because
Mm-hmm.
they're so afraid to do anything
Mm-hmm.
and they don't know who to believe and they don't know what to do. And really, it's just a matter of I'm present,